welcome everybody back from lunch and to this last plenary of the forum. It's the plenary on the power of partnerships. My name is Åsa Andersson. I'm working as a senior program specialist at the Swedish International Development Cooperation Agency, and I have had the pleasure of co-chairing this plenary together with Pascal Alotey from the United Nations University in KL, Malaysia. Unfortunately, she can't be here. But I will just, meanwhile, the panelists, our esteemed panel here today, take their seats. I will just introduce our moderator for the session. It's Dr. Anders Nordström. Anders is our Swedish ambassador for global health. He's also currently on the boards of Gavi, of UNAIDS, of Global Fund. The latter he has been the interim executive director for when it was set up back in 2000 something, and then he's also been acting director for WHO. He's been the director general of the Swedish International Development Cooperation Agencies, but now he is our ambassador for global health. So welcome very much, Anders, and thank you for taking this forward. But before we even start the panel, we have our participants from the adolescent youth constituency of the PMNCH, who will perform a small and short little theater piece that Beatrice has put together, and it is called Imagine, and it is about partnerships. So please go ahead.
Naye was born and raised in a community where access to quality, sexual reproductive health and rights information and services was not a priority. At the age of 18, she got pregnant, and unfortunately, she died due to pregnancy complications and lack of quality maternal and child health care services.
Our condolences to Naya's family. Naya was such a brilliant
Listen, youth lack access to quality sex education and youth-friendly centers. More than ever, this is the time we need to create awareness. We need to penetrate the communities and make them understand that they should have access to all of this information. We cannot allow our kids, our children, and our mothers to die. No, they don't deserve to die, to have that kind of death. Naya wouldn't have died if all of this were in place. What am I even talking about? Naya wouldn't have been pregnant at all if all of these materials and information were in place. This is the time we need to create awareness. We need to work together as collaborators and not competitors to make sure that we achieve this. We need to make sure we improve all of our emergency facilities, such as having more than enough blood banks and operating theaters. When we invest in women and girls, everyone wins. And that is the only time our men can be happy. That is why we need to do that right now. We need to make sure all of these are in place. We need healthy lives. Women need to enjoy the fruits of their labor. We can't afford to lose our children at tender age. Do we?
Thank you for watching the 9 o'clock news on Sun TV. My name is Malemo. The news. The recently announced budget for the financial year 2018-2019 confirmed a 50% reduction in funds for the health sector, which has put a strain on the operations of the Ministry of Health and the National Health System. Around the country, communities have protested the cuts to stocks of medicines, malfunctioning equipment, and too few health workers to serve those seeking health services. Among the most affected are expectant mothers, children, and people in need of family planning services. Our reporter Afia is on the ground with a live update.
Thank you, Malima. An 18-year-old is said to have died here due to pregnancy complications. Now she, like many other women and children before her, have become victims of a broken health system and a lack of state support. This is Alfia reporting for the 9 o'clock news.
Thank you, Afia. In other developments, the government has issued a statement defending its position on the new financial year's budget allocations, indicating that the country's priority is infrastructure development, especially roads and electricity. During the press conference held at the office of the president, the government spokesperson also made statements banning the advertising of family planning and condemning those utilizing these services. Let's take a break and we'll be back in the business news.
Did you watch the news?
Oh no, I didn't. I missed it. I was watching football.
An 18-year-old girl died. You know why? She was pregnant with her first child. So when she went to the hospital to get medicine, it wasn't there and she died.
Ah, oh no, not again. Different names, same stories, similar problems. I'm just tired of this. When is this going to end? People dying, our youths are dying. We need to do something.
I'm telling you, the situation is worsening and our government isn't doing anything. This is too much.
But wait, I think we should find support from one of our funding partners. That would really help.
Hi, yes, you wanted to see me.
Hi, thank you for meeting with us at this notice, this really short notice.
Yes, your
Really
email
do
looked
appreciate-
urgent. What's the matter?
We have an urgent problem in our community. Maternal deaths are increasing. It's really terrific. And we believe that with your support, we can increase maternal and child health services. The situation will improve.
Yeah, it's a desperate problem. I hear what you're saying. But my organization is looking to do something more in the economic employment sector, you see. So I can give you 1,000 sewing machines and then create jobs, and then maybe one day they can afford healthcare. How's that?
Just give us the money, give us the machines, we'll just do something.
Okay, come with me. I've got to run to my next football meeting, so hurry up now.
They are going to be happy. I'm telling you. Yes, we are going to. Yes, they will.
Like the machines, they can actually enroll their
Yeah, I'm so sure they're going to be happy.
Yes,
I'm telling you,
so
it's
that
going
they
to be
could use it to
Oh, Madam Chairman, I'm so glad to meet you. I'm so
Nice to meet you.
Can I talk to you? Hello, committee members. I'm so happy to meet you. I'm Joeri with my friend. We are from Together Team. We are so happy. I'm so sure by the time we leave, you're also going to be so happy. It's going to be so
Yana,
good.
stop exciting us.
You see
Thank
all
you.
this? It belongs to you.
Wow.
1,000 sewing machines in here.
Ah?
What did you say?
Excuse me?
Machines, sewing machines.
Oh, wait. Are we... what? Give me a break. Are we going to save the lives of our children who have died, bring back them to life?
Please ask her.
This is not the system that we want. Our health system is not working. There are no medicines in the hospital. The last thing we need are sewing machines. Now, I'm closing my eyes. By the time I open them...
My daughter died because of complications of this. No, please!
Let's pause for a minute and imagine. Imagine how things could have played out differently for 18-year-old Naye if the communities, governments, implementing partners, donor community, and other key players had a common vision. If all key players shared commitments. Imagine if the political will and government priorities were in favor of community needs. If the recipient country communities and all beneficiaries were made partners, consulted first, and involved in developing their own solutions, other than imposing them. Imagine if adolescents and young people were meaningfully engaged. If roles in partnerships were defined to ensure accountability and transparency. Imagine if health system strengthening was at the center of global health partnerships. If skills and resources were shared and not used in silos. Imagine how complex health challenges could be solved successfully in this world of scarcity. Pause for a minute and imagine. Thank you.
Thank you very much. Thank you very much. Let's give them a hand again. So very much welcome back after lunch. This session is going to be about not what we heard about here, which was unsuccessful partnerships, but possibly where we ended about what are successful partnerships. I think we are all very much committed to partnerships in one way or the other. And what we will try to explore now with those colleagues here is when and why does it work, partnerships? Second question, we have now an SDG agenda, which is quite different from what we have had in the past, where we have the MDG agenda. And why are then partnerships specifically important now for us to be able to address the SDG agenda? And a final question we're also going to speak a little bit about, when we meet here next time, what will the PMNCH partnership look like? I was here, Minister, a few years ago when you also hosted the partnership meeting, and that was a big, I think, excitement and inspiration for many of us. Now we're back. The question is, what will the next partnership look like? I hope that this could be an interactive session. I've asked all panelists to speak fairly shortly so that we also have time after each of them for you also to make some remarks or possibly making some questions to them. I'm also not going to introduce you by long CVs because I don't think we should spend time on that. But nevertheless, I would like you to get to know the people that are sitting here. So I've got one very small question to each of you, just so that you get to know who's actually here. So if I would like to start with Minister Manetta Gandhi. You are the Minister for Child and Women's Development, or Women's and Child Development. I read your CV, and I saw that you have a background on the environmental side. They even said you were an environmentalist activist. Right now, there is the climate conference going on in Poland. What are your reflections in terms of the links in between what we need to do for the climate, for the environment, and health? Minister.
The answer is quite simple. To get health for anybody, women, children, men, anybody, the universe, you have to concentrate on the land, the water, and the air. There is nothing else. So if we're going to play around with systems and expect that with our systems we get everything into order, a health system for every country, but at the same time we drown ourselves in pesticides, and we have no water. So then what's the purpose of anything else? So if we could bring those factors in and make them pertinent. See, we have siloed. The Ministry for Environment does water and health. The Ministry for Child Welfare does children, but never the twain to meet. But if we could make a understanding that my children die because the pesticide ministry is plugging pesticides, and the urea ministry, fertilizer ministry wants more urea bought, and the environment ministry exists only to certify, then how will my children survive? In Amritsar today, there have been not one, but hundreds of cases where children are being born without their top, what's this called? You know, when you born these bones here, you can go right through to the brain. And then they form in a few days. Yeah. Well, now the children of Amritsar, those bones don't form at all. And they put that directly down to the use of 38 pesticides in the soil. So how do I save those children? With doing what? Getting a health system. So that's what I mean.
So we have a win-win opportunity here. What is good for our environment and our climate is also good for people's health, and the other way around as well. It's a very strong and appealing
No, they're not
message.
the other way around at all. What's good for people's health is not necessarily good for the environment because it's not considered like that.
Ah.
And well people don't do good things for the environment. Well people do good things for themselves. So
This could be a long debate and discussion. Thank you very much for that. Let me continue to introduce then, if we start at this end with Desmond. Reading your CV, you are a youth leader and a very ambitious youth leader, and you've been in quite a few places. You're coming from Cameroon, you've been in Kenya, you have been giving a number of different awards. So my question to you is, what drives you?
What drives me is the passion to make change as any normal human being born. in the world where there are always troubles, and no one person can fix these problems. And that is why the partnerships are quite important. I am driven because I have a purpose, and the purpose is to make change in the world. And it's so sweet that I have been making this change in the field of health, and I am leveraging my skills as much as possible, as I can, to make this change happen.
Thank you. I think you're an inspiration for many of us. Claudia, you are working today for USAID and you're engaging a lot in global health issues. But when I again read your CV, I saw you started working very much in communities in the US. So my question to you is that what do you think you could bring back from this partnership meeting to the US?
Well, I think there's many aspects of global health that are particularly applicable in low-income neighborhoods in the United States. I also think there are things that we have done in the United States that also are important in our work globally. So there should be this actual transfer of appropriate technologies between the two. But I think I have tended to work in very disenfranchised communities. My first real international experience was working door to door in a large para-urban slum outside of Mexico City. And I was able to see how having groups of people who come from very, very different places and basically, as they say, paracaidistas, they come in, actually parachute down to these areas, that it takes a system. You have to think about how to form a system in that community to make it work for those people. And I think that then working in Bangladesh on the Urban Family Health Partnership, again, one of the very first acknowledgements that urban areas, slum areas, again have difficulties in creating systems that work for the people living in those areas.
But
So,
would you agree with me that also, I mean, there are some challenges in the US today, and there are some lessons from here that is also relevant for you people at home?
oh, absolutely. I think about 12 years ago, that in fact, there was a whole program on what can we bring from the developing world back to low-income areas in the United States.
Thank you.
Yeah.
Betsy, you are working with the White Ribbon Alliance. A very simple question to you. Reading your CV, I saw that you've been working in some 20 countries. So which is your favorite country?
Oh, come on.
Oh,
It has to be India.
She is the one who needs to tell us.
Belize, right? I did live and work in Belize. Actually, it was an amazing place to live and work because it's kind of a microcosm of what happens everywhere in the world. So it's the opposite scale of India. It's very small, but you have all of the same issues, all the same kind of stakeholder groups. And so that was immensely important for my learning of how do you work across sectors, work with movements from communities to top-level political leaders. And I learned how to scuba dive, so.
Thank you. Preti Sudan, you're the Secretary for Health here in India. A little bit of a similar question as I asked the Minister, because you were in Stockholm quite recently, and we had quite an interesting evening there when we were cooking together and have a lot of fun. But I also saw that you were the Secretary for Food before here in India. So my question is a little bit similar. What do you bring then from that perspective in terms of food into your work on health today?
Okay, actually ma'am was reminding me that I brought millets into the food for children. So that's actually we added, you see the point is that how to bring nutrition into food. So we have a huge public distribution system for food. And I must say at the prodding of Honorable Minister Women and Child, we added millets to the first time in the country for children's food.
Very good, thank you very much. Anarudia, you are today working for Gavi. You're the Deputy Executive Director then for Gavi. Now you're waiting for the question. And the question is, what is most difficult, to work with global health, the global health institutions, or work for the Indian administration?
So really the disconnect that exists at the global level vis-a-vis countries. And I think this whole thinking at the global level that one size can fit all countries, it doesn't fit all countries any longer. And my learning from India is that even a national dress does not fit every province, and every provincial dress does not fit every district, and every district size does not fit all blocks or sub-district units. So I really think this whole notion of just doing things in a standardized manner, which still very much operates within the global health, I think it really needs a review, because this is the time when we have to think of differentiated approaches, more tailored, more targeted approaches. The world is no longer divided into rich or poor or developed or developing countries. Developing countries, some of them have made enormous progress. And on the other hand, some developed countries have a lot of vulnerable populations. So really the world is converging somewhere in the middle. And that is why SDGs are so universal. And I think this is the time for us to challenge ourselves to think differently.
So a little bit more of the federal approach as we have. I mean, India is more or less the whole world, and here you have numbers of states that are very different, and you have much more of a federal approach. So possibly we need to learn from that when it comes to working at the global level with the global institutions. Katja, you are the leader for Women Deliver, and we are very much looking forward to the meeting in Vancouver next year, but I'm very much looking forward to another meeting as well. And my question is to you, when will we have the Men Deliver meeting?
I could be really cheeky now, but I'm not.
Saying that men are not delivering?
You said it. I didn't. No. We have an organization that's called Women Deliver because women do deliver, and that has been underestimated forever. Men deliver as well, and we can deliver even more together. And I just want to say the Women Deliver meeting is not a women's meeting. It is a development meeting, it is a solution-focused meeting, it's an action-focused meeting, and those solutions and those actions are not done by just one gender. It's done in collaboration. So
Thank you very much. So this was the warming up, so that you know who have we got here. I would like now to start to give the floor to the Honourable Minister to share some words and some reflections with us around partnerships. Minister.
I congratulate the Ministry of Health and the Secretary of Health, Preeti Sudhan, for bringing us all together in the power of partnerships, working better and smarter together. I would like to thank all the ministers who've come from different countries, and of course all the officers who have come and my colleagues that are sitting on the table with me. I'm going to talk to you today about the same thing, the power of partnerships, but I'm not talking about international partnerships. I'm going to be talking about partnerships within India. And this is at the core of my being. I'm an NGO person. I've run NGOs my whole life, and I've seen the difference between good and bad ones, but I've seen that they work. At the moment, I run the largest animal NGO in India with 36 hospitals, and that this today in front of you is my day job. The aim of all government action is essentially to get the benefits of each program down to the last citizen of the country. However, no governments, whether America or India, or Belize for that matter, have got feet on the ground. So we, in terms of the last person to do this, the person at every level, we have the ability to make policy, we have the ability to correct, we have the ability to monitor, but we don't have the ability to do. So therefore, if we look at Indian structures and who will ensure, who will give us maternal child health, mother and child health, the only cases where we actually have feet on the ground are the Anganwadis workers for the Integrated Child Development Services Program and the ASHA workers for the National Health Mission. Both of them are women who live in the village. And they're usually the strongest, most dominant women of that village. they're also one of the few educated women in that village. So they carry a huge amount of power within the village. Now, besides this, we use the NCC, the NSS, the Nehru Yuva Kendra, and the Army at different times on a contingency basis. But those really are not as effective as what we could do. Therefore, the civil society organizations, or what we generally know as NGOs, are the major fallback option for the government to not only expand the reach of its development programs, but also to obtain feedback on how a particular program or scheme is running on the ground. If I use the Anganwadis and the Ashas, they have a stake in saying that the program is doing extremely well, because if it doesn't do well, they are the ones who lose their jobs. So therefore, we use them to fulfill the program, and they do a good job, especially the Ashas. But we cannot depend on them for feedback. So who can we depend on? The NGOs. Let me give you, before I discuss the importance of partnerships, let me give you an example where this partnership has helped in bringing about the tremendous success of a program. In January 2015, my ministry was selected to implement a national scheme for improving the child sex ratio at birth, because we had many fewer girls as per 1,000 boys. In some places, they had gone as low as 795, which means over 25 lakh women or girls were being killed, either in the womb or as soon as they were born, or being starved to death. So Preeti Sudan, here on my left, was the secretary, and she and I sat down to, well, basically go to the drawing board. How do we, in the shortest possible time, achieve a success of having an impact? Why are women killed in the womb? When I say women, I mean children, but why are female children killed in the womb or starved? Because 3 or 4 attitudes. One, that the female girl child is going to be a nuisance because we'll spend so much time educating her and feeding her, and ultimately she's going to get married and then work for some other family. So, paraya dhan, what we call someone else's treasure. And we don't mind, in India, what's not mine, it doesn't matter. So, the second is, how do we look after this child, even if she's mine? The point is, how do I prevent her from being sexually assaulted? How do I look after her going to school, which is 3 kilometers away? How do I look after her in the evenings? How can I leave her alone? It's better not to have her than to worry all the time about her virginity, as it were. The third thing is that men are more valuable because when we grow old, they will look after us and they will provide a financial return to us, and women won't. So these 3 things, how were Preeti and I, who'd simply be handed 100 crores and said, okay, go and do something. How are we going to make this a success? Because in a patriarchal society, how were we going to change attitudes? This is not a program that you can throw money at. I can't pay people not to kill their girls. I can't pay people not to get pregnant. Or I can only do it through changing their minds. Let the girl live. She is valuable. She is as valuable as you are or as a son would be. So how to change this mindset? So the first conclusion we arrived at was that this kind of program had to involve a number of partners who had to be taken on board. And the second thing was that the program should be so simple that any partner would join us and start working with us. They're not going to be thick papers and studies and people doing things. What do we do that is so simple that in the quickest possible time we achieve success? So first we decided to use the Anganwadi as one of the partners. Our main partner was going to be the district administrator. But the Anganwadi was the second partner, so that pregnancies got registered with us. Only the Anganwadi and the Asha knew how many people were pregnant in the village. Now, if that matter of pregnancy was hidden from us or from district statistics, then it was much easier to kill. You're pregnant on Monday and you're no longer pregnant on Wednesday. But why? Nobody can say anything because abortion is legal in this country. But abortion, when it is sex-related, is not legal. So we have 2.5 million Anganwadi workers in the country. Then, having registered the pregnancy, we partnered with the ASHA workers on the ground to encourage and ensure that every childbirth takes place in a government facility. It is easier to kill a child if you're going to have a birth at home, because the dai will come, the midwife will come, and she will give a little bit of tweak here and there, and the child is dead. So we made it compulsory for the first time that in the 100 districts we chose, which were the worst statistical districts, that they would have to go to hospital. Any birth at home would not be recognized or the parent would be penalized. So registration of pregnancies ensured we were in a position to track down those situations where a child was not born, because the birth of the child also had to be registered in the Anganwadi. So these were the cases where the child was aborted, and one of the reasons for abortion was usually that it was a girl child. So we blocked both these. Then we took on a whole lot of civil society partners to expand the outreach of the program and send a message that the birth of the girl child is to be celebrated. So we took on government officers, NGOs, elected representatives at local levels, students, individuals, and each one was a partner. They resulted in so many innovative ideas. For instance, one district mandated that the public display of births and girls, what we did was every village had to have a board. And we learned this from one district. Now this board was called the Gudda Guddi board, which meant the boy and the girl in a very warm fashion. Gudda Guddi means girl toy and boy toy. But every village had to have this prominent in the panchayat, where it was written what was the sex ratio, so that everybody passing it every day could really feel embarrassed that there were 700 boys in the village and there were 20 girls. And this had an immediate effect. Because nobody had realized that the ratios were so weird. So it gave visibility to the program. Another district then taught us with networked electronic boards, where the figures of the entire district were aggregated, brought in every day, and they changed in twinkly little lights every day. Another girl born here, another boy born here, another girl born here, so that you knew how it was happening. Then state governments started schemes for scholarships for girls. Some communities converted religious festivals into celebrating the girl child. One lot, every time a girl was born in the district, they arrived there as if they were coming for a marriage, and they beat the drums and they sort of got really excited, and a cake was given to the family, so that, not only did it celebrate the birth of a girl child, but the public visibility and celebration of that girl child prevented the mother from killing her in the next 1 year. Because now she was a property of the village. One village did something completely unique. They planted trees every time a girl child was born. And those trees became the property of the girl child. Now remember, if a tree is a mango tree, it could easily bring you 25,000 rupees a year. So if you put in 10 trees in the girl child's name, she already had what we call dowry, ready for her, waiting when the fruits were sold. So hundreds of NGOs came forward to organize workshops and seminars. That was the least of it, but at least it kept the momentum going. And what we did was we paid informers who would tell us, that family, they're going to kill their child. And then those family would be called right from the beginning and said, we know you're going to do this, so don't even think about it. Then we paid informers, we paid grandmothers, if you please. Grandmothers were our biggest hurdle and success story, because in this patriarchal society, strangely enough, grandmothers decide, the boy's mother, decides whether the child is going to be born or not. So we got grandmothers working for us with separate NGOs called grandmother NGOs. We started giving awards to women. We started giving awards to, just about anybody. We had lots of small little films made, and we put them on TVs that went straight into the village. We then ran competitions for where you could use our logo, which would be the most bizarre place. And anybody who sent a photograph in got X amount of money. So we found the logo of Beti Bachao coming on sweets. We, of course, found it at the back of every bus. We found it on wedding cards. We found it on stickers behind buses, school stationery, school bags. So we had this spot the logo. Then we started giving prizes to people who would mention daughters on their business cards. For instance, it's so common in India to have Gupta and sons. But if you had Gupta and daughters, then you got a prize from us. So we did get that. So what we did was we basically got the Save the Girl Child, Beti Bachao logo all over the place. And we used radio to its nth degree. TV is very expensive and TV is limited. It's seen at a time when the man wants to see it in the evenings. And nobody wants to watch goody messages. They just want to watch something else. So we used the radio, which is on the whole day. And how did we do all this? Only through partnerships. Any entity, individual, or organization who decided to come on board was welcomed, trusted, and appreciated. So if the first thing is that if you want to have credible partners work with you, trust them. Make the association with them simple and easy. Today, for instance, in India, if an NGO wants to work under a government-funded program, it requires registration at a dozen places, which I sort of give up immediately. A compliance and reporting mechanism which often consumes half their time, and a bureaucratic process which is outright scary. Obviously, the partner which crosses all these hardships to work with government is either a crook or a die-hard maverick, or somebody so exhausted he's not going to do anything later. So to attract partners in the NGO section, people who come because they want to come, not because they're paid to come, we must be seen to be welcoming and respecting them. Rule number 4, pay the NGOs on time. Pay the NGOs. I have people who run creches across India. Can government run creches? No. We have people who, all the NGOs run women who are abandoned, women who are in conflict with the law, perhaps. They run these, but do we pay them on time? Sometimes, sometimes not. But when you don't pay an NGO on time, their staff run away, their motivation disappears, their commitment to the program becomes desperate, and then everybody suffers. So we should release all grants in full, and I speak to all governments on this because we don't. A few years, to give you my example, and anyway, I'll leave the example out because I don't have much time, but we have to respect the fact that any partner we take on will have their own agenda and interests. And it's because of this that they collaborate with us. To the extent that this agenda or interest is legitimate and fair, we must respect their agenda as well, and ensure that in the course of the partnership, this is addressed and met. I'm really happy that today we are proceeding, this is our 4th meeting on it, on a large global partnership. And the things that I say on a micro level for India and her NGOs, India and her partnerships, I'm sure have to be respected when we do a global partnership. And I'm sure we will learn from each other. And to tell you what was the end result of our Beti Bachao year, 1 year. Preeti and I, when we started off, held very little hope that it would result in anything, because something that is 10,000 years old cannot be overturned in a few months, even 12 months. So a patriarchal society cannot be turned on its head, except little by little, push, shove. And yet, these things that I told you are so simply done. And at the end of 1 year, for instance, one district in Haryana, which had 830 girls per 1,000, was suddenly 930 girls. It was the most remarkable success of this government, of the many successes, but this was the first and most remarkable success. And we have not looked back. We simply have not. It's difficult now to imagine a time where it was just 4 years ago when people were happily killing girls. Now, I can't say it doesn't happen, but it is now the exception rather than a rule. And for that, I have to thank Preeti. So she would be the best person on this. No, it's really not a question of scratching each other's back. We are now in different ministries, and this is my last few months in it. But why? Because we kept it simple, because we respected NGOs, because we gave awards and praise freely, because we used the radio, because we arrested people who, I've forgotten the most important one were the ones that were doing PCP and DT secretly. You know, you went in and got your sex identified of the child. We just simply did not allow it. We simply did not. So we used just simple techniques, 4 or 5, and the end result was that out of 100 districts, in 68 districts, we crossed 100 plus. And in the 30 odd that we remained static, or we did not do well, we found the reasons for that. In some cases, the district magistrate was changed every 2 months. So therefore, nobody took ownership of the program. In some, there were riots, or there were different situations of instability, social instability, in which case, a girl child is the last thing on anybody's mind that they want to be born. So we then corrected those things for the next lot, or we tailored our program to deal with current social instability. We tailored, as you said, we tailored it for the microcosm. And now this program has been increased by the Prime Minister for all 600 districts. And we'll get there. Thank you.
Thank you very much. Thank you very much, Minister, both for being extremely frank and also sharing with us. I mean, this is basically a standard roadmap for how do we do, and also addressing a horrifying problem. Thank you so very much. We will move on, and I will ask a question to Desmond, who's sitting at the end of this table, because the question is, okay. Yeah, do we have any okay, but if we have any very quick comments or questions to the Minister, we have a microphone somewhere. Or you were, yes, please. We need a mic. They're coming with a mic.
Thank you so much for your presentation. It was really incredible. I just had a question about the system of informers that you were talking about. So if you had an informer who told you that somebody was planning to
kill the child,
and then they went ahead and did it, what were the steps that you took? And were there any cases?
No, they didn't do it because we took immediate action.
So there was never any case that it...
No, there must have been. There must have been lots of cases. We shouldn't have informers at every step.
Mm-hmm.
So it must have still been. But the point is, the statistics at the end of the day, and they were given to us daily statistics, daily, weekly, monthly. You know, we didn't sort of gather them around at the end. But if there had been more children being killed than not, then those statistics wouldn't have been 930 from 830. Mm-hmm. So I'm sure 1 or 2, 3, 4, maybe 100 children still got killed.
Mm-hmm. And did you have any system in place to kind of...
I said just a quick short, see whether we have any more questions or comments from anyone else. Because we also, I know the Minister has a bit of time constraint, but we also have, we need to allow that we have the rest of the panel also.
Can I answer that?
Yeah.
You see, for example, one of our provincial states of Haryana, for example, they put a reward of a certain sum of amount of money for any information where there is, you know, in sonography clinics, there is illegal sex determination going on. Or, as ma'am said, that, you know, there is going to be a possibility of killing. So action was taken by them. They had actually made some squads, as they call, special cells, to tackle with these, and basically, you see, it has to be done at the micro level. So the district administration, or administration even below the district is a small administrative unit that we have in India. So as ma'am said, it was not a perfect system, but you see, it's a system that sends a message. So the message was that when it is...
Thou shalt not kill.
Okay, thank you. I think your message also that this is about people's mind. Money could be a bit useful, absolutely fund NGOs and other partners, but most importantly, this has to do with the mind shift of all of us, and I think your message was extremely strong and clear. Thank you very much.
Thank you very much. Thank you.
Thank you, ma'am.
I'm sorry I have to go, but I have a meeting at 2:30.
Desmond, my question to you, and I'm giving you this question now first for a special reason. My question is about who do we need to give more space at the table when we have partnerships? And I think your obvious answer will be youth. So I would like to challenge you a bit to say, I mean, from your experiences, this to give space to different partners, can you reflect a bit on that?
Absolutely. Not only youth. First of all, I wish to congratulate Minister Maneka and India for being proactive when it concerns health and health of girls and women. I'm sure Katja Everson should be quite impressed by that. I would first of all wish to also congratulate Katja Everson and Helga. These two ladies who deliver not only babies, but deliver resilient societies. And they have worked very hard to make sure that their organizations have a model, effective youth engagement strategy. And it is worthwhile that this comes into partnerships. The AYC and the Women Deliver Young Leaders program are incredible platforms for effective youth engagement. Of course, you know that when the people who are the target of the health exercise are not seated on table, accountability is limited and the whole action is also limited. I have this anecdote which I shared yesterday in one of the breakout sessions, that when your son is sick and you take him to the hospital, I think the best person who stands to explain the malady is your son. The doctor has to ask him, where do you feel pains? And he has to answer for the diagnosis to be good, lest the diagnosis might not be correct and treating strategy also disturbed. That is exactly how global strategies may fail, global partnerships may fail if the key people who are the target, and when we talk about the target, it's not only young people. The target of your campaign could be women, it could be the rural community or the elderly. They should be represented on the tables. Not only that, but at all stages. Youth engagement has two models. The first is what I term the table dressers model, where young people are invited to meetings and pictures are taken, and it is seen that young people were there, but they are actually not involved in all the stages of that process. The second is what I call effective youth engagement, which is also called meaningful youth engagement. It is not tokenism. Young people are involved at all stages, and this is the best strategy we can use to reach out to the billions of adolescents and young people who need comprehensive sexuality education right in the far-flung areas of Nasarawa in Nigeria, of Ikiliwindi in Cameroon, of Jabalpur in India. These are hard-to-reach areas. But as an economist, I'm also interested to seeing that these strategies actually deliver the goods to these target people. And I congratulated the minister a few minutes ago because of a brilliant idea, a brilliant campaign to save girls from being killed. It is not only young people being seated at tables, but young people who can also contribute. You know, there should be a change in this idea of youth engagement. You have also young professionals whose skill set can be used as far as partnerships are concerned. It is needed. Amongst us, we have economists, we have medical doctors, we have accountants. I think their skills are needed when crafting strategies to reach out communities. That contributes to accountability in the structures. It contributes to good governance and to management. Now, I would tell you a little bit about what I have done as a meaningfully engaged young person. Thanks to these two organizations I have mentioned earlier, we have been able to adapt the Advocating for Change for Adolescents toolkit and have contributed immensely